today we're going to be doing a chemical peel on our lovely patient here. So she is starting our protocol today that is chemical peels and microneedling. So we like to start out with a chemical peel to even out the skin tone, get rid of some of the dead skin buildup, and then 2 weeks later she's going to get microneedled, and then she's going to alternate chemical peels and microneedling for 3 treatments each, which is 6 treatments total. So I've cleansed her skin, and we're going to get started here. So the first thing that we do is prep the skin with our prepping solution. This is also a good gauge of how the patient will respond to the peel. Sometimes the prepping solution can be a little bit spicy. So I'm going to be using the prepping solution here. How's that feeling?
That's good.
Good. So this is her first chemical peel. So we're going to be starting off with one of our peels that's great for all skin types. It's also safe for sensitive skin. And the peel that we're using today has 6% of TCA, which is a type of acid that is great for fine lines, wrinkles, as well as pigmentation. And then the peel that we're using also has kojic acid, which is a natural lightening ingredient, which will help with sun damage and pigmentation. All right, so we'll let that dissipate. Alrighty, so we're gonna start off with the peel now. And this type of peel is self-neutralizing, which means that we don't remove the peel. So the peel will stay on your skin and develop over the next couple of hours. And for that reason, we want you to be careful about making sure that you don't get your heat up too high. That can make the peel develop a little bit more. So for the rest of today, no working out, no hot showers. Just make sure that you keep your heat down. Alrighty, so are you ready to get started?
Yep.
Okay, so we're gonna start the peel up here. How's that feeling so far?
Okay.
Good. And this peel works in layers. So we start with the first layer, see how the skin responds, and then we can continue for up to 4 layers. Have you tuck in your lip. All right, so on a scale of 1 to 10, 10 being the worst and 1 being nothing, what would you say your skin is at right now?
I'd say like a, I don't know, 2 or 3.
2 or 3? Perfect. Let me know when your skin is back down to a 1. Okay, I'll just continue to fan it here. And a little bit of redness is normal. You know, the skin kind of reacts, you know, once you get that first layer on. So seeing a little bit of pink in your skin is normal.
It feels like a 1 on most spots, but like
Okay.
down in the corners, maybe a 2 or 3 still.
Sure. Most of our clients often will have some areas that are a little bit more sensitive than other areas. Typically kind of around the nose and around the mouth can be a little bit more sensitive. The nice thing about this peel is because it's done in layers, we're able to avoid any layers that are having too much sensation. How's it feeling now?
Fine.
Okay, good. Okay, so we're moving on to the second layer here. And so what can you expect after the peel? After the first day, your skin is gonna have a nice glow to it. Your face will be pretty luminous. And then after about day 3, you'll start to notice a little bit of flaking. It usually starts around the mouth and then works its way outward. And the flaking can last anywhere from 3 to 5 days. The most important thing is to not pick at the flaky pieces of skin. The main reason for that is if you pick at the skin that's peeling off, the skin is attached to live tissue and it can cause pigmentation, which is one of the things that we're trying to get rid of with the peel. So just making sure that you, you know, don't pick at your skin, no exfoliating afterwards. All of those things are really important. Where would you say your skin is at now?
Same as before. Like.
Okay, perfect. All right, so we're moving on to the third layer here. As you can see, we start each layer in a different spot on the face. The reason for that being wherever we start is gonna have the highest concentration. We wanna make sure it's even throughout the entire face. And we wanna make sure after this peel that you are very careful about wearing sunscreen if you're out in the sun. It's going to increase your sensitivity to the sun after you get this peel. And even though it's winter time, the sun does still peek out here and there. So on a scale of 1 to 10, where would you say your skin is at now?
A 4 spots.
Okay. So we're moving on to the final layer now. And on this last layer, we're able to kind of customize the treatment a bit. Our patient here, she mentioned that she's feeling it sting a little bit more in her cheeks. So I can avoid that area on this last layer while still getting other parts of her face. That's the nice thing about a layered peel is you're able to customize it. Whereas, a peel that is just applied all over the face is not able to be as customized. Okay, so we'll start here. And you can see she's a little bit more red in the cheeks. So on this last layer, I'm avoiding that area. I'll have you tuck in your lip. Okay. All right. And then we'll fan. What level would you say you're at now?
4.
Okay, perfect. All right, so now we are going to move on to one of our last steps here. We're going to be using the Advanced Treatment Booster. This product is able to intensify the peel. The nice thing about this as well is we're able to kind of spot treat. So, our patient here, she's been feeling a little bit more sensation in her cheeks. So I'm going to be using the Advanced Treatment Booster on almost every area except for the cheeks. That way we can intensify the peel where we want it to, and where she has a little bit more sensitivity, we can leave that alone. Now this may spike your sensation a little bit, that's normal. So I'm going to start on the forehead here. And I'm going to be applying this Advanced Treatment Booster to the nose as well. She has a little bit more sun damage on the nose. And this product is just going to help kind of intensify the peel. Since this is kind of our beginner peel, we're able to bring it up to more of a moderate level peel with this booster. What sensation would you say you're at now?
Maybe 5 in the forehead.
Okay. So as you can see, it spiked her sensation a little bit. And that is normal and to be expected. A little bit on the chin. And as you can see, her skin has a nice glow to it. You get an immediate luminosity when you get a peel. So the day of, your skin's gonna look luminous and great. Same thing with the next day. And then on that third day, you might start to see a little bit of peeling starting around the mouth and working its way outwards. All right, so we're moving on to the last step of the peel. This is our rebalance. What the rebalance does is it brings your skin back to its natural pH so that the peel can do what it needs to do. Your skin goes through a lot of changes throughout the day as far as pH goes, things like soap, pollution, that all changes the pH of your skin. This is going to bring it back to its sweet spot so that the peel can do what it's meant to do. And keep in mind that this rebalance moisturizer might spike your sensation a bit, and that typically goes away after about a minute. So you might feel a little bit of a spike here. Did you feel it spike a little bit in sensation?
Yeah, in the cheeks.
Mm-hmm. And all of the products that we're applying today are all that you need for the rest of the day. So there's no need to wash your face tonight. You can resume using your normal moisturizer and face wash tomorrow morning. But you will want to stay away from any harsh products like retinols, tretinoin, glycolic acid, those types of products for at least a week. What would you say your sensation is at now?
3 or 4.
Okay, perfect. So we'll fan a bit, and then we'll apply a little bit of sunscreen, and then she's good to go.
So can I apply makeup tomorrow as normal? Is there anything I should avoid?
So tomorrow you can apply some makeup as normal. We typically recommend that the only makeup that's safe post-procedurally would be a mineral makeup. And obviously that's not doable for everyone, so just keeping in mind that you want to be gentle with your skin. So you can apply makeup tomorrow, just use a light hand and make sure that you have a lot of moisturizer before.
Would a gentle primer be beneficial, or?
Yeah, so as long as it's a product that has worked for your skin in the past and you don't have any sort of reaction. I also typically recommend after a peel kind of using the spot treatment on yourself. So doing a little test spot, you could apply any product that you use kind of to your jaw area and see how your skin reacts. You know, for myself, after I get a chemical peel, my skin is a little bit more reactive to products that I use in my normal day. So just making sure that everything that you use is not going to be irritating to the skin. It can make you peel a little bit more than you want.
Are there any moisturizers I should avoid?
So the only thing that I would avoid in a moisturizer is anything that contains any sort of exfoliating acid. So any moisturizer that contains retinol in it, you know, any sort of glycolic acid, salicylic acid. So anything that's anti-aging or for anti-acne is not going to be safe until after about a week after the peel.